Hello, facial palsy here and Bell's palsy here. We are continuing this week during the facial palsy awareness week with some information. And what I would like to talk about today is the first thing that you should likely be doing besides eye care, like I mentioned in my last post. When you have flaccid paralysis, and I've heard so many different things from patients, and some patients have been told even by neurologists or other doctors to you're gonna be fine in 3 months, and just wait and see, as well as chew gum. And I can tell you that chewing gum, I would not recommend that. It's only you are very more likely to actually chew gum on your strong side if you're gonna do this while your other side is paralyzed. And guess what? You're only gonna make that other side even more tight. When half of your face doesn't work, you're gonna tend to overuse, and because it's the only side that works, you're gonna use this too much, too much. Chewing and drinking with doing this with a straw, and chewing just on this side when there's nothing really happening here. You're just pocketing food like crazy. Yeah, so my advice for this is definitely to not chew gum. That is the last thing I would do, and instead there are some stretches that you should start doing on your strong side, as well as some just light, gentle massage on your involved side, plus everything in dealing with eye care. But this is in the acute stage pretty much what you want to do. Please consult with a facial therapist. They can really educate you on all of this, all what you should be doing. This is a very small field. We're not a lot out there. This is a growing field though, and I think facial therapy and rehab is in its infancy currently. And this is also why you might be frustrated by the lack of general knowledge from other medical professionals. So there's always been, at some point in history, a field of medicine that was not very well known, very well studied, very well understood, and for who the patient dealing with that particular problem were not being well taken care of. Some of us are trying to change this with facial paralysis, and I think if you're watching this video, you are already aware that there are some therapists and people to help you out there. Don't hesitate to leave a comment, send me a DM if you are interested in a consultation, or would like to find out a name of somebody that lives close to you. I might have a name, I might not, but it's always worth a try. And this is something to be taken seriously, just like any other ailment that you would see a physiotherapist for. So have a great day. Take care.